Columbus City Attorney hopes to reduce shoplifting by helping those who steal out of need. Today on City Chat, Columbus City Attorney Klein is here to further discuss the Buckeye Deflection program, an initiative to improve lives and meet the needs of those struggling in the community. City Attorney, it is such an honor to have you in studio. We are really excited to talk about the Buckeye Deflection program, and it's a unique pilot program for now. Could you tell us the main objective of this program and everybody who is involved?
Yeah, so when I became city attorney, I posed a very simple question to my team that really yields a complex answer, and that is why? Why are there defendants appearing in our courthouse? Like, what is the reason why they're committing crime? And so I tasked them with building a program, and we started, as you said, a pilot with big box shoplifting. So big box thinking Kroger, okay. Home Depot, Lowe's, Meijer, the bigger kind of convenience, or the bigger grocery stores, hardware stores. But task them to think outside the box of building a program that answers and addresses the why. And when you look at county prosecutors, city attorneys, district attorneys across the country, a lot of the programs that are geared towards diversion or deflection they focus on drug addiction and mental health, and rightfully so, because drug addiction and mental health play an integral role in driving people to make criminal decisions. Yeah. But it goes beyond that, and what makes our program unique, and really the first of its kind in the country, is that we certainly look at drug addiction and mental health, but we also look at food insecurity, housing insecurity, transportation issues. It's like, what are the underlying reasons why people commit crime? So what we did was we partnered with a third-party healthcare organization that works in this space, but not in the criminal world, but works in this kind of identifying needs space. And we partnered with them, and they came in and they started asking our defendants, separate from the prosecutor's office, but asking our defendants, like, why are you committing these crimes? Through a Medicaid-tested questionnaire. 36 questions that go down the list, and then each individual defendant has a unique problem that then we address through a diversion program. So for example, we thought drug addiction and mental health would be the #1 reasons was driving theft. It was actually food insecurity. And so part of our diversion program is taking a step back and saying, like, hey, you're stealing food from Kroger. Did you know that a block and a half from your house is a food pantry? No, I didn't know that. So part of your diversion program is you have to go to the food pantry, you have to meet with the staff there, you have to know that the resources in your community. And I would say out of the 300 or 400 people that have gone through the program, we've had a 90+% success rate. And in the criminal justice world, that's unheard of.
What factors does your office, the prosecution division, what do they consider low-level offenders for the program?
So it's somewhere between your first offense and 7 offenses, roughly. And I know that seven, yeah, and I know that sounds like a lot, but the reality is when you get much more than that, then we start asking questions whether you're part of like one of these global theft offenses, okay, which actually also exists. So this is really geared towards the people that make just really bad decisions that are driven by things that really are preventable if we look behind the curtain and figure out what's making them make these bad decisions. And so we actually, the retailers love it, because if you pick up the newspaper and read stories about retail shoplifting across the country, it's on the rise. The money, and because of the theft, the money and the prices are being passed to us as consumers. So this is an effort not only to change people's behavior, to save consumer money, to keep prices reasonable, but it's also a way to truly improve public safety. Because if our program is successful and 90% of the people going through, meaning they don't commit another crime, yeah, that is really what public safety is all about. They're not committing another crime again.
Yeah. So you did touch up on this, but how does the program intend to assist individuals in refraining from future theft and improving their lives? So you said 90% they don't have reoccurring crimes. How do you guys do that? Like, can you give us like an inside?
Yeah, I mean, I think it really boils down to the analysis of what's driving the bad decisions. Yeah. And it's working with the healthcare organization who is an expert in this space. And prosecutors may not be the expert in this space, right? Because we prosecute people, and rightfully so, we play an important role in the criminal justice system to put bad people behind bars, and there's certainly bad people that deserve to go to jail for a long time. But thankfully, that's the minority of people that go through the criminal justice system. The vast majority, and in the Franklin County Municipal Court, we do 100,000 cases a year. It's a lot of cases. The vast majority of them are just folks who make really dumb decisions decisions. And they make dumb decisions that are sometimes based upon socioeconomic needs. And so this healthcare organization who's an expert in this space, through this questionnaire and screening, they really do a deep dive to figure out the motivation and rationale why people are committing the crime. And then we create a plan to treat that. In the same way, I guess from an analogous standpoint, it's the same way what healthcare is. You look at the reasons of why someone's sick and then you create a medicine or a prognostic plan to treat them with medicine or exercise, whatever it may be. That's what we're doing here. We're looking at the underlying reasons why people are committing crime and we're addressing those surgically. And I think that's why we have the success rate, coupled with we actually have a great partner who knows what they're doing, and in a lot of ways there's hand-holding of making sure and nagging the person and bringing them along, making sure they're visiting their food pantry. But why we've seen such a success rate is because of our partner doing such a great job in identifying, assessing, and treating the problem.
So if there is an individual who is wanting to just make more money, let's say they shoplift because they want to resell items like from a retail store, does that qualify for the program, or like would you be able to like redirect that into getting help? Or like what would be the remedy for that?
It could. I mean, it's hard to say a one-size-fits-all of who's in, who's out. We actually rely on our retail partners. They don't have veto power over who is in our program, but they do have influence.
Okay.
So, for example, if they know someone who's just a chronic repeat offender, someone who has been in the store so much, who treats their staff, poorly, even when they're confronted with shoplifting. If we have negative police interactions where the folks are violent or resisting arrest, like those can be factors that are disqualifying to be part of the program.
Gotcha.
Like we're really looking at is this person able and interested in changing their lives for the better? When you look across the country, a lot of prosecutors have thrown up their arms and saying we're not even prosecuting retail theft anymore. And then you're seeing big kind of smash and grabs across the country. You're seeing the rise in retail theft. And that's why in a lot of big cities across the country, even shampoo is locked up behind closed doors, and you have to have a clerk come help you, access it. We do take shoplifting and theft seriously here. We may not take it with a punitive approach if everyone goes to jail. There certainly may be a subset of people that deserve it and will request it. But we're approaching it from a standpoint that how can we truly improve public safety? And if we're going to truly improve public safety and make our community better and make our community safer, especially for our big box retail friends, then we need to figure out who's committing these crimes, figuring out why, treat that reason. And I think the proof's in the pudding.
Definitely. The Buckeye Deflection program, it kind of builds upon the Buckeye Diversion program.
Yeah.
So how can you kind of touch on both
Sure.
and how they are different?
So it all is a matter of when you engage, when my office engages. So deflection is actually before a charge is even filed. So that is a situation where you're caught shoplifting, and before we as prosecutors even charge you with a crime, we offer you the program we just talked about. We offer it to you before you're charged. So that is helpful for you not having a criminal record. The diversion program is you are charged, you plead in the case, and then as you work through your criminal case, the services that we talked about, the questionnaire, the screening, that's when that takes place, and then the charges are dismissed. So it's really an inflection point of when you're charged or not charged, but the services being offered and everything that we've talked about are the same. It's a matter of when we're going to get to you to offer those services.
Is it up to the officers that come onto the scene to decide whether the Buckeye Deflection program will be offered to them, or is it offered to is it just a certain criteria?
Well, there's certain criteria, and at the end of the day, it's actually the defendant's call. If you're eligible, there's some defendants who'd rather just pay the fine or maybe face some jail time than actually have to do the hard work that's necessary to be successful in this program. Like, this is accountability. You're not getting off the hook. There is work that needs to be done here. Okay. And some defendants would rather just plead guilty and take the criminal offense. Others want to seize the opportunity for what it is to be the moms and dads they want to be and be contributing members of our society. And if we have an important role to play to make that happen, then we're going to do it.
I think that this program is just really, I mean, you mentioned before that it's really the only kind in the country so far. As the city attorney, like what makes your like heartstrings pull to like see from like the criminal's perspective? Because like when I first heard about this program, I was just like, what? Like, how does someone have that much empathy to, you know, really think on this other side and putting the law and like what programs can be created through it? So can you just kind of speak to how it personally like affects you, what makes you want to take action?
Well, you know, I ran for city council. I became council president. I ran for city attorney because I want to help people and make a difference. And I know in the political world we live in today, you may not think that elected officials actually have that as a motivation, but it truly is why I want to serve. And not that you have to run for office to make a difference. People do that in their own lives in many different ways in their community. But part of that effort in the criminal justice system is the recognition that there's a lot of improvement that needs to be made in the criminal justice system, from improving equity outcomes based on race, but also to improve public safety.
Yeah.
And what I've noticed and what I've come to realize in my 6.5, almost 7 years as city attorney is that there are complex situations because people are complex. And there are very violent, dangerous people out there and folks who have no regard for the law, and sometimes prison and jail is the only place that they need to be. But that is the minority of people that are involved with the criminal justice system. And I think we as prosecutors have a role to play in improving the criminal justice system and the role that we have to make our community safer, to think of new programs like this one that can identify the reasons why people are committing crime and then treat those reasons so that crime is stopped. Because I want to be a prosecutor that certainly puts the bad guys in jail, but I also want to help people become the moms and dads they want to be too.
Yeah.
And it's not a one-size-fits-all approach, no matter what Twitter or Facebook says as you deal with criminal justice issues. You have to look at each individual and each individual's acts and each individual's background separately. And it's up for us as prosecutors to triage them based on their history and their conduct and the opportunity that lay ahead for them. And a program like this, I think, pulls the curtain back and does a deep dive with a scalpel into how we can specifically treat an individual, and then they can be the best person they can be. And not only is that great for their family and great for their neighborhood they live in, but it's also great for society.
Yeah.
And it improves public safety, which is the role that I think I play, and everyone in Columbus is safer because of it.
It's like such a great idea.
Oh, thank you.
That's awesome.
Thank you.
Well, thank you so much for coming on and talking to us about this. Thank you.
No, I really appreciate you having me on.
I'm Josie Smith. Thanks for watching City Chat on CTV.